Welcome to Lowcountry Snapshots. I'm your host, Courtenay Guthrie, and today I'm introducing you to a man who's been fighting the rising cost of healthcare for the past quarter century, I think. And he's making sure to keep those healthcare outcomes improving for you, and all while married to me. Yep, I'm introducing you to my husband, Fred Guthrie. Welcome to the show, Fred.
Thank you.
All right, so I'm a romantic. Everyone knows this. How did we meet?
Well, I was delivering pizzas while driving a Porsche convertible, and oddly enough, and one day this beautiful young woman hops into the office where I'm working in the back and says, I said that one day I would marry a man with a Porsche.
I always said that I would marry a man with a Porsche.
Right, and then you took off.
I was trying to be cute.
So I found out who Courtenay was that day, and we did.
So wait, this was after you had already attended college and after you had already had a career. What was that in?
Right, so I am in software and computer technology. So I had left a job with the government to get some more education. I took some programming classes, advanced programming classes at a local tech school during the day, and at night I was delivering pizzas. So I was in between kind of career adjustments.
And of course you fell in love with me and we got married.
Yeah, the rest is history.
Right. So you got a job, and your job was with?
Yeah, it was a consulting company called Dynamic Resources Incorporated, DRI, and we had a number of clients primarily in the healthcare space in the Atlanta area, one of which was the CDC. So
about when was this?
Right about the time, remember the AIDS epidemic and a lot of focus around there, and right about the time there was a lot of activity and a lot of protests happening at the CDC, and I had a hard time getting into work some days because this whole thing about healthcare privacy of information and personal data. So that's about the time, not long after, that Congress passed the HIPAA legislation, which is the Health Insurance Portability and Privacy Act. So there was a lot going on in healthcare at that time.
A lot going on. Now you played such a fundamental role in this that you have your name preserved. Tell me about that. It's preserved there at the CDC. Where is it preserved and why is it preserved?
Well, I think because they're being nice to those of us who started early. We were part of I think a groundbreaking project. We actually implemented a wide-ranging online database, the first of its kind for healthcare epidemiological data research. So it allowed all the epidemiologists across the country to submit these requests for information for doing their local research to, local hotspots and outbreaks so they could address those more quickly. Right about the time we built the first version of that, one of our team members comes back from a conference in DC and says, let me show you this thing. They're going to call it the internet. And here's this Mozilla browser, and they had to start from scratch. But it was a really interesting project, and I was one of the team members who helped do the initial product.
So you've been in healthcare for quite some time. I mean, in the software part of healthcare.
Right.
Okay, so you ended that career, and what did you do, and why did you leave that?
Well, I'm a software guy, and I've always wanted to develop new and innovative software products. And I have a very good friend from way back in the old days who basically grew up together. We always wanted to have a business together. So he had an opportunity to purchase a software company from a local man in Athens, Georgia, and it was in corporate real estate. So we ended up forming a corporate real estate software product and software company, which you spent much time working there as well. So
I did. I
that
helped.
was a little divestment from healthcare, but it was a very good opportunity to learn, the intricacies of business and a lot of the factors involved in, corporate America.
And while that was important, another major event happened in our lives. Now, a little backstory. We already had a child at this point.
Right.
And something happened during the pregnancy. Do you remember what it was? You better.
Yeah, well, you nearly died. It's a little story there.
Not even lying. I nearly died.
Yeah, it was pretty traumatic. So we, at the time, we had health insurance when you had our first child. And even with that, it was a little bit of a surprise what all we had to go through as part of that process. But when you got pregnant with our second child, we were self-employed and self-insured at the time. So.
Now wait, but the important information about that was that in that emergency delivery I had a cesarean section.
Right.
And I became, after that, a surgical assistant. And so the word was that if you were involved in healthcare and you had already had a complication, you were going to die the next time, right? Right. So then I got pregnant.
Right. So you knew about as much about healthcare and working in the surgical suite as anybody I knew. And we had a good friend. At this point, we had moved from our software company.
So then I got pregnant, and what did I say?
You said, I want the best care, and I want to have this pregnancy managed, from at the beginning to end, and I want a C-section, I want to plan it, and it's not going to have any emergencies, no surprises, we're going to have a healthy, happy baby.
Because I was terrified, I didn't
Right.
want to die. And you had started working with your friend, and I started going to this doctor that was involved with this friend, right?
Right. He was a local OBGYN at the time, and great reputation, and very, he had 9 or 10 children of his own, so had been through that process some. And we talked to him about what it would cost to have a child, what he would charge us, and what the whole bundle package was going to be to have the delivery.
That's the key. You wanted
Right.
to know the bundled price. And when you came to me and told me how much he said it would be, what did I say?
That he was crazy and that wasn't nearly enough.
There was no way. Absolutely.
Right.
He was off by a mile. So who was right? Just for the record.
Who's always right.
Who is always right? Good answer. So we have a beautiful baby girl.
Right.
And the bill comes in, and what was the reaction?
Well, it was kind of shocking because we paid to the penny the physician's fee that he had talked to us about, and he did his surgical fee and everything. We thought it was included. I thought it was included. But then we get the anesthesiology fee, we got the operating room fee, we got additional hospital materials and cost fees. We had, there's all kinds of ancillary charges, and it was about 2.5 times what the surgeon had charged us.
Wow.
Yeah.
Quite the bill.
Right.
I remember your partner was very upset. So we were paying in advance to try to make sure that we didn't get hit with the big bill, and then we did. And that went to Dr. Ashford, Dr.
Right.
Clinton Ashford in Athens, Georgia. And what did he decide to do?
Well, he was a little surprised too. Most of his experience with the hospital was going in, performing surgeries, making rounds, and then going to his office and billing his patients for things. And I guess when he had his children, he would do the delivery and, never really had to pay many hospital bills, I suppose, on his own. So he actually dug into it and discovered he was surprised by all the ancillary costs and the total cost of care of a delivery that he performed. That was the first time he had really investigated the full costs of a delivery at the hospital performed by him.
And he decided to come up with a solution to this rising cost and how much
Right.
it was expensive. What goes into that? What was thought at the time, just there at the beginning, of how to approach this?
Well, there was a little bit of movement going on, particularly from the government trying to implement some, I guess you call them trial projects, to see how to decrease the cost of healthcare, to increase the outcomes, the healthy outcomes. And there was a little bit of experimentation, but you can't really experiment with people's lives, and you can't just cut costs and expect people to get healthier. So it was very complicated, it's a complicated arena. So the surgeon, and we ended up working with him a few years later in this project, wanted to see how to get providers to cooperate, to agree ahead of time on establishing a cost of care for an episode for like a delivery or a hip replacement or some type of surgery. so that everybody involved, from the anesthesiologist, the hospital, the surgeons, the primary care physicians, would have a fee established ahead of time so that you could tell a patient it's going to cost this much money. And then the providers would get a certain set amount of money, and overall it would be less for the health plan, it'd be less for the patients, and more predictable financial outcomes.
Then I have to ask the question, could it only be things that were neatly bundled, like a pregnancy, you know when it started and when it's going to end, a knee surgery, you know when it starts and when it's going to end? Like, could you do anything as big as something like diabetes?
Right. So healthcare conditions and events are pretty complicated all across the board, as you know. So we were able to, and you'll see modern iterations of this today, where you can take anything from an ear infection to diabetes or chronic asthma or a hospitalization because of asthma or a surgery, and consider that an episode of care and have pretty well-established definitions on what that captures.
Okay, so Dr. Ashford comes up with a plan and he brings you and your business partner on board.
Right.
And what were the first steps and the first approaches that was involved in that?
Well, we brought in a research department at the local university to get a lot of analytical support. We had medical support from physicians. We had the technology support, the part that we were building. And we had to build an entire system, a systematic way for our software to evaluate healthcare claims and what providers, what members, all the information that goes into these episodes of care, and define those in a way that they're clinically correct and that they can be measured for good outcomes. So that was really the early process that we established. And then how to pay the providers, again, efficiently and equitably for doing these procedures.
Okay, so you had to get the doctors, those are the providers,
Mm-hmm.
and the hospitals on board,
Right,
and the insurance companies on board,
right.
and who else? Anybody else?
That's pretty much it. The providers of the healthcare and the payers of the healthcare all have to collaborate for these things to work.
So what did you find in the payment part? What did you find as far as how billing happens and what's decided on what things cost?
So if we had a part 2 of this series, I could go into all of the thing about healthcare finance. It's an incredibly complex subject, and I don't want to put your viewers to sleep. But I will say that payers and providers, at least traditionally, haven't gotten along really well. So, providers, that could be your local doc, it could be a hospital, but a provider typically wants to give people health care. They want to make them better. They want to give healthcare services, and that's what they study. They go to school for, it seems like, a million years so they can get out, but what they end up doing is reports and data submissions and quality reports and insurance compliance reports, and they pay $1 bazillion for malpractice insurance, and they have to go through so many hoops to practice healthcare that they kind of don't trust those outside of healthcare to tell them what's best for healthcare. So when you're pre-authorized from your insurance for a procedure or you're denied, the providers have to go and justify why you should get this procedure. So there's a lot of back and forth and a lot of headbutting between providers and payers. So we're building a system in which typically the payers would aggregate all this data and send a payment to the providers, and the providers have to believe them. So you can't just create a black box where you say, you owe us $1,000, or, oh, here's your $10 bonus. There's a lot that goes into this, and part of that is provider trust. Provider that is healthcare, the health plan, doing this correctly.
So this was such a new idea
Mm-hmm.
that Dr. Ashford actually got a patent on this process, did he not?
Right. I think we got like an 8-point patent approved, still on file with the PTO today.
That's wonderful. Except he's not in business today doing this. So what happened?
Right. We actually built a product and we shopped this around with health plans, but it was really ahead of its time. So we had one healthcare-based company who was looking at buying the patent or buying the product we were building. And that ended up not going through ultimately. And the co-founder of the company ended up moving on to other challenges. So, but it still was a good idea, and as a matter of fact, there are other healthcare technology companies that took the information from his processes and the processes we built and commercialized them. So
That sounds good the way you phrased it, but it also sounds very bad for him.
Yeah.
How has it moved forward? What was the thing that pushed it forward and made it successful, or a successful idea?
You mean episodes of care in general, or a lot of the healthcare reform?
A lot of the healthcare reform, and specifically this payment reform system.
Right. So eventually the government formed a department called CMI, the Centers for Medicare and Medicaid Innovations. They have kind of a brain trust of physicians and policy people and healthcare people who collaborated to come up with these innovative ideas on healthcare payment reform. It'll be anything from how to do kidney care better to how to do oncology care better, how to do episodes of care across a certain number of episodes, how to do what they call shared savings programs. And many people in the audience may actually be part of something called an accountable care organization, or an ACO as the industry knows it. That is one of these healthcare innovation, payment innovation products that were created through this department and through the collaboration of technology vendors, health plans, providers, and the government over years.
Wow.
So.
Okay, so when that fell through, what happened with you?
So we ended up doing some consulting on our own for a while, and we actually consulted with a bunch of hospital systems to participate in one of these government pilot programs, and our consulting company got 3 of the 5 participants approved. We submitted for 3, and all 3 were approved of the 5 that did this program. They're big hospital provider systems.
Is that something normal? Does everybody get?
No, typically that's not what you see. So it's something we're very proud of, because what we brought in was not only the ideas about episodes of care, but the whole process improvement, because we walked around the hospital for days. We talked to the surgeons, to the nurses, to the practitioners, to the administrators, to people scheduling surgeries, to people cleaning the hospital, and found out really where were the inefficiencies taking place, what were things that could be improved. And we put all of that into our very 390-something page document that we submitted to the government on how these hospitals intended to improve their health care while decreasing the costs using some of these innovative payment models. So my business partner ended up going to work for one of these big healthcare companies creating technologies, and they actually hired him to build a similar type of software product to help drive these innovation programs. And I ended up actually going to work for that same company not too long afterwards. So we built and commercialized another episode of care style product for the healthcare industry.
Wow. Okay, and that was successful?
Yeah, they had a pretty good success, sold it to a number of health plans, and they're still in business today selling that product across the nation.
Awesome. And you left that company, though.
Yeah, so I got the opportunity to go to this somewhat unknown company. They have technology that's more about healthcare data exchange, but they really wanted to get into this area of healthcare payment reform. They knew that they wanted to be ahead of the times and not behind the times when it came to this stuff really hitting its stride in the market. So they recruited me and brought me in to come up with a software product, to design it, to come up with the roadmap, to figure out what the industry was going to need to implement these types of programs. So it was really carte blanche for me to be able to come in, assemble a team of experts, and have those people work with me to build this product. And it took a number of years, but we tried to really expand on everything we've been doing in the industry for the last 20, 25 years and create a product that will allow a health plan or a provider organization to model, to design, to contract, to run and pay really any kind of payment reform program.
So who are you marketing to?
Primarily health payers, so the big blues of this or that or Humana's of the
Insurance
world.
companies.
Insurance companies of the world we talk to and have some as clients. And we're also talking to the provider organizations because, as I was saying before, providers are just overwhelmed. So you as a health plan will contract with providers and pay them to manage care for this healthcare product. But you as a provider might have 7 to 10 payers. You've got CMS for Medicare, you've got your Medicaid, you've got XYZ health plans, and you're having to submit claims to all of these different payer entities. But you're also having to submit quality reports to each of these entities, and you're having to submit membership reports, and you've got a ton of stuff to do. So we're also working with the providers now to actually give them a better platform for managing their contracts.
That sounds very complicated. Tell me how you're saving me money, how you're saving the provider or the payer money.
Right. Well, it's not just about the money, and I'll get to that, but really, if it was about saving money, we'd have sicker people, because
I was going to get to that next.
Right.
I was going to say, as a person who wants to be kept well, how do I get well?
Healthier patients, healthier people save healthcare dollars. That's how you save money in healthcare. So every program that we build, every program that's really out there in the market today has a quality component. So you can't just cut a bunch of money off the top of your healthcare services. You have to actually show that members are getting healthier. They're not going back to the emergency room for some sort of ED readmission, or you're not going back to the hospital after a knee replacement because they have to get something done to that knee.
You're using letters.
I know. So
you had a story where you personally got to witness the measures that you had worked so hard to get implemented in your own life.
Right. My father had to have valve replacement surgery in his heart a few years back, and quadruple bypass, and there was a lot of follow-up care that had to happen. And I went in to be with him as he recovered from surgery, and I saw the providers, the nurses, the practitioners, doing all these various things, almost like checking off of a list to follow up to make sure his after surgical care was effective, and it was following all of the processes that we had talked about over the years. Making sure that his blood sugar levels and the blood oxygen levels were good. They made sure to take the tube out of his throat before he became distressed because he was waking up. It used to be that a physician had to come, give an exam, and then to pull the ventilator tube out of a patient. But often if you had a surgery, say on Friday, a patient might be on that ventilator until Monday when the provider came back to the hospital and did their rounds. Now they've changed that so that if the numbers are good, a nurse can check those numbers, they can see what the blood ox level is, they can check the status of the patient, and they can actually have somebody specialized in that pull the tube so the patient is much more comfortable. They're not sitting in the hospital for an extra day or 2 days for no reason.
So this one instance shows how better managed care allows for cheaper costs and a healthier outcome. But this has been done to a point where it's saved so much money, it's had astronomical effects. Can you think of an example of that?
Sure. There's actually an example to give that a hospital in California, they focus on orthopedic procedures, and they've actually got the system so streamlined, so fine-tuned that they can have a patient fly in with their family, put the family up in a local in a local hotel, while the patient gets the surgery, goes through rehab, flies them home, and the whole process is cheaper than them having the surgery done in the local hospital.
That's incredible. And the measures that they took to decrease that cost had to do with just maintaining, cleanliness and sterility on the field, those kind of things?
Right, reducing infection rates, reducing revision rates for like the knee surgeries, just simple things that they could do to make sure that the patients wouldn't come back. There's a lot of variability in healthcare. That's part of the problem that we're focused on. And so there are certain surgeries where that variability raises the money a lot. And so for instance, knee or hip replacement, you could put in a titanium knee joint or you could put in a stainless steel knee joint. who needs one versus the other. So, getting the physicians to agree on what's appropriate in certain conditions to keep the cost down while giving the right amount of care to the members, that kind of thing.
Your career is such an amazing journey in lowering healthcare costs and also improving those outcomes for people. I know I have seen cases like you with your dad where the quality measures have gotten better. So I really appreciate all your hard work and for putting up with me as your wife. Thank you so much for coming on the show today, Fred. I really had fun talking to you.